Go ahead, Vanessa.
All right, good afternoon, sisters and friends and guests, and welcome to our Women's Heart Health webinar entitled Let's Get to the Heart of the Matter. My name is Vanessa Spearman McCarthy, and I am chair of the National Alumni Association of Spelman College Health and Wellness Committee, and we have a wonderful program planned for you today. As outlined, we'll have greetings from our national president, followed by the introduction of our keynote speaker, Tracie Hartsfield. After her presentation, we will have the introduction of our panelists, and then after our panel, we'll have a brief question and answer period. So without further ado, I present to you our National Alumni Association of Spelman College President, Kiva Wright Berry, class of 1979. President Kiva Wright Berry, you're on mute still.
Thank you. You didn't hear all those wonderful things I just said. Anyway, I want to welcome everyone to our February webinar sponsored by our Health and Wellness Committee. The committee's theme for this 2020-2021 program is Women's Health Across the Lifespan, hashtag Women's Health for Life. This afternoon's presentation and discussion is entitled, Let's Get to the Heart of the Matter. As you may know, Black women are at a greater risk for heart disease than white women. But did you know that 80% of heart disease-related events are preventable? We hope that the information this webinar presented by our Spelman sisters will be timely and informative for all. In our decision to focus on hashtag Women's Health for Life, we noted that as alumni of Spelman, we should be the ones to own the issue of Black women's health. We have the knowledge and talent to fully inform our sisters about ways to maintain healthy lifestyles. So please continue to join us for our health webinars and other activities during the remainder of this program year. Earlier this program year, we signed an MOU with the March of Dimes and became a national service partner. So during the months of April and May, we will be working with March of Dimes by participating in the March for Babies. Stay tuned, and we hope you will be able to join us for that. Thank you.
Thank you, Madam President. Our keynote speaker is our very own Tracie Hartsfield. As a self-described military Navy junior brat, she was reared in Jacksonville, Florida by parents Master Chief Leroy Hartsfield Sr. and Viola Hartsfield. She is a proud 1988 graduate of Spelman College, earning a B.S. in biology. She then furthered her education at the graduate school program at the Medical College of Georgia School of Allied Health in the Physician Assistance Program. And later, she earned a master's in physician assistant studies in 2006 from the University of Nebraska Medical Center. She's also a registered cardiac sonographer. One of her career highlights is that she served as a sub-investigator from 1994 through 2000 for the ALL-HAT trial. ALL-HAT stands for Antihypertensive and Lipid-Lowering Treatment to Prevent Heart Attack trial. This was conducted in 600 clinics and centers across the United States, Canada, Puerto Rico, and the U.S. Virgin Islands. And upon the conclusion of the study, it was found that thiazide-type diuretics should be the first line for management for systemic arterial hypertension. And it is more in favor and superior to calcium channel blockers, such as medicines like amlodipine, ACE inhibitors, such as medicines like lisinopril, and alpha adrenergic blockers, such as doxazosin, and preventing one or more major forms of cardiovascular disease. She is a charter member of the Greater Columbia County Alumni Chapter of Delta Sigma Theta Incorporated. She is a fellow of the American Academy of Physician Assistants. She's a member of the Augusta Chapter of the Lynx Incorporated. She's associate member of the American College of Cardiology, and she's a proud member of Tabernacle Baptist Church. Her hobbies include genealogy, and she's researched her mother's tree back to 1845. However, she's most proud of the fact that she searched her father's tree all the way back to the year of 1795. Additionally, she enjoys stamp collecting, photography, and taking selfies. And because, technology does not always agree with us, our speaker is here with us via voice, and we do have her slides, but we will not be able to see her live. So please welcome our speaker, Tracie Hartsfield. And please give us a moment while Madam President pulls her slides up.
Okay, are we ready? Okay, I'd like to first say thank you to the National Alumni Association of Spelman College for allowing me to speak to you for a few moments regarding women and heart disease. I plan to share a few things that I know about heart disease, and I hope I inform you about the best ways to proceed with living a healthy lifestyle. So naturally, this is Black History Month. So naturally, I would include a history and a pictorial history and slides from the birthplace of Black girl magic from the classes of 1892, 1907, and 1893 of Spelman College. Okay, objectives for this talk. What I hope to do today is define heart disease, identify risk factors for heart disease, discuss the unique characteristics of heart disease in women, and share steps for early identification of symptoms, and discuss various therapies for heart disease, and increase awareness of new technologies in valve disease management. So this is a month for love, and this is my first love, my father, Leroy Hartsfield, and my non-modifiable risk factor. Well, why I have a non-modifiable risk factor for heart disease. And these are my parents, and again, this is a month of love, and they were my example of love for all of my adult life, Leroy and Viola Hartsfield. So let's get to it. What is heart disease? For the purpose of our talk, we're going to define heart disease as any disease that affects the heart, the vessels, the valvular heart, the valves of the heart, and cardiomyopathies, which means heart muscle. Anatomy of a heart attack. Let's have a small discussion about what the heart is. The heart is a pump. It has an in valve and an out valve. It has basically two arteries, the rest are all branches. And a heart attack is when there is not enough oxygen supplied to muscle because of a blockage. It's either caused by a narrowing of the heart or plaque rupture. Risk factors. Okay, who's at risk? Modifiable risk factors are those things that we can change. Unhealthy diet, physical inactivity, hypertension, obesity, diabetes, elevated cholesterol, tobacco abuse. One additional thing I like to say about tobacco abuse is that it is the #1 cause of preventable death in the United States. And one of the few things you can do to prolong your life is stop smoking. And if you notice, in the purple is motherhood. I always have to put that on the slide when it comes to risk, because mothers put everything and everybody before themselves, and sometimes as a sacrifice to their health. I've even had a patient who had a dissected coronary artery who was not ready to go to the OR because she had to get her child off the bus. She got her child off the bus and she survived. And also, I like to talk about obesity. I want to tell you that one of the hardest things to do, and don't fight me, is to tell a Black woman that she needs to lose weight. Now, you may say, why is that? Because Black women have high self-esteem more than other people, and the men in our culture celebrate hips and thighs. They even make songs about it. Okay, again, about the risk factors. Diabetes, like more than likely, adults age 20 and over, Hispanic and Black adults were more likely to have heart disease. When it came to total cholesterol, more than likely, it was even as far as the distribution among the races for high cholesterol. But when it came to hypertension, as we well know, non-Hispanic Black adults are the most likely to have hypertension, and obesity was most prevalent in Hispanic and non-Hispanic Black adults. Now, I have to talk about the brick house and why that is important. Like I mentioned earlier, Black women tend to have higher self-esteem. I read a study in Glamour magazine that was done by Glamour magazine and L'Oreal. And in the study, they asked 2,000 women how they felt about themselves. And the group of women that felt that they were beautiful and more attractive were Black women. Not so much with the other races. Everybody knows the Commodore's brick house, and everybody knows that they want to be a brick house. But for us, we have to consider obesity and our BMI, body mass index. We want a body mass index less than 30 to help prevent heart disease. Non-modifiable risk factors include age, sex, and family history. Of course, older adults are more likely to have heart disease, and men are more likely than women. Okay, and we should also know that heart disease is the #1 killer of women, and also that women present very differently from men. We're not the same. You'll sometimes hear men say they had chest pain in the middle of their chest. They feel like an elephant sat on their chest. That's not so with women. They usually have upper body pain, symptoms of GERD, whether that they think is GERD, cold sweats, unexplained fatigue, lightheadedness, or nausea or vomiting. So it's important to be aware of the fact that women present very differently from men. Health disparities. I want to talk too fast. I need to go back one slide, please. Okay, I want to talk a little bit about health disparities. It's important to know that Black people in general are more likely to have, like I said before, hypertension, diabetes. But what we also need to know that we're less likely to receive the cutting edge treatment for those diseases. So it is important for us to know our risk factors, know what we have to do to change our daily habits and lifestyle changes to improve our overall health, and also become an advocate for ourselves when we are in the room with a physician and our healthcare providers. So what are we? WAP, WAP, WAP. We are proactive. Everybody knows Cardi B, but not that one. So what we need to be on the lookout for: unexplained fatigue, beyond baseline, not relieved by sleeping or rest, insomnia, shortness of breath, lightheadedness, dizziness, and heavy perspiration, and insomnia. Some women also present with abdominal pain that they perceive as GERD, and upper body pain. A lot of times a woman will tell you that she has pain between her shoulder blades, and it can end up being heart disease. All right, cardiovascular statistics. I like this slide because I want to first say that there's a myth when it comes to heart disease. It is not a disease of the elderly. It is not a disease of old people. It presents in old age, but it manifests in old age, but it actually presents earlier. And it can actually develop before birth. And 1 in 3 heart diseases occur, and 1 in 3 deaths from females is caused by heart disease. Again, about the health disparities, 337.4 per 100,000 people are Black people. We're more likely to die from heart disease. Again, that's just a graphic showing that Black people are more likely to die from heart disease. Diagnosis and treatment. There's several ways to diagnose heart disease, including cardiac catheterization, cardiac CT scan, cardiac MRI, EKG, stress tests, and in emergent situations, troponin levels. What's important is for you to know that these tests are available for you because of health disparities. Black females in particular are less likely to be referred to for these tests to diagnose heart disease. All right, decisions to manage coronary artery disease. I work for cardiothoracic surgeons, and usually by the time you come to our office or our clinic, the die has already been cast. So for heart disease, there are 2 types of management: surgical management, non-surgical management, and you can also manage with medications. However, coronary artery bypass graft, that's when the surgeon takes an artery from the chest and a vein from the leg and bypass blockages on the heart to increase blood flow to the heart. There is also non-surgical management with a stent placement, but however, studies have shown that CABG, open heart, is superior to stent placement. Also, I'd like to talk about valvular heart disease. I think that we have someone on our committee or on our panel that has had to deal with valvular heart disease. The thing to know about valvular heart disease is that it presents similar to heart disease: fatigue, shortness of breath, dizziness, unexplained tiredness. It is a progressive disease. Unfortunately, it cannot be prevented, but it can be treated. And ways to manage valvular heart disease: you can have a surgical management or a non-surgical management. And one thing about a surgeon is they are concerned about risk. So that is why I keep telling you about your risk factors. The first thing a surgeon will ask you when you come in when a patient's presenting for CABG is they want to know what their renal function is, their heart function is, what the cholesterol level is, and if they're diabetic. And because surgeons are about risk, the people who are poorly controlled with diabetes, hypertension, cholesterol levels, they're less likely to be permitted to have CABG. And also with my hospital, they have a different management for valvular heart disease, particularly aortic valve disease, and that is with TAVR. TAVR is trans-aortic. It's a percutaneous way to replace the heart valve. It's catheter-based, and they go through the heart and go through the right groin to place a heart valve. Okay. When you go to the OR, what happens is the surgeon makes an incision in your chest. He separates your breastbone with a saw, push your heart to sleep, connects you to the bypass machine. That is when he'll take the vessel from your chest and from your leg to bypass the blockages on your heart. Now, for a non-surgical management of valvular dysfunction, we have, like I spoke about before, the TAVR procedure. The TAVR procedure is an excellent choice for people who are very high risk. Like I said, it's percutaneous. They go through the leg, and unlike an open procedure for valve replacement, you go home the next night. Now, I would like to show examples of prosthetic valves. You see an onyx mechanical valve and a tissue valve. Either the valve is going to be porcine, which means it's from a pig if it's tissue, or a cow, or it's going to be mechanical. The difference between these 2 valves is if you have a mechanical valve, you'll be you have a blood thinner for the rest of your life. And usually the decision to use a mechanical device is based on age. Usually people above 55 are going to get a tissue valve. Keep going. Okay. Now, as part of the CT surgery team at Augusta University, I do endoscopic vein harvest. This is me harvesting the vein from the leg to give to the surgeon to make a bypass conduit for the heart. And close-up view of what happens, we place a camera in the leg, we guide it up to the groin, and we cut branches and we remove the vessel from the leg. New technology, like I spoke about before, is TAVR. That is what's really hot right now as far as valve replacements. And this is a picture of the TAVR valve in the heart attached to a balloon. And I would like to show you an example of what happens during TAVR. So this is a depiction on YouTube that we're going to see. And it's the Edwards valve that we usually use when we do TAVR. That is the depiction of the heart and the aorta. And that's a calcified valve that doesn't open well. And that's unfortunate because you won't deliver blood like you need to the rest of the body. So what happens is a catheter is fed up through the aorta to the heart. And then a balloon is placed over the catheter into the diseased valve. And opened up. And the next step is actual seating of the valve. That's usually done by a cardiothoracic surgeon and a cardiologist together. And this is deploying the valve into the heart. And that's the end of it. The main takeaway I would like for you to know from the talk is know your risk factors. What is normal blood pressure? Less than 120/80. What should your cholesterol level be? Your cholesterol total should be less than 100. Less than 70, I'm sorry. LDL, less than 100. HDL, greater than 45. It's important not to smoke, to lose weight, and to exercise. And I hope I have been helpful for you today with this talk.
Thank you so much, Tracie. That was an amazing talk, and your graphics were awesome. They're very vivid, and it was very helpful to see a talk made in the image of us. You know, if you have the opportunity to hear a heart talk, never do, the slides look like you. So we thank you so much for your expertise and your time and your kindness. Next, we will move on to our panel, and I'll give all of their bios of our presenters, and they'll be in the order in which they will present. Our first panelist is Dr. Eniki Mack, Spelman College class of 2001, who earned her medical degree from the Medical College of Georgia in 2005. She completed her residency in internal medicine at the University of Tennessee Health Science Center in Memphis, Tennessee, and her fellowship in endocrinology at the University of South Carolina School of Medicine in Columbia, South Carolina. Upon completing her training, she entered private practice at the Northeast Georgia Diagnostic Clinic in Gainesville, Georgia, where she's currently employed. During her time in private practice, she became a fellow of the American College of Endocrinology and served on the board of directors for the Georgia chapter of the American Association of Clinical Endocrinologists. She currently resides in Duluth, Georgia, and loves to travel in her spare time. Dr. Shermnae Jones serves as Assistant Corresponding Secretary of the National Alumni Association of Spelman College and is a member of Spelman's class of 2004. After graduation, she completed a post-baccalaureate program at the University of Connecticut and then went on to receive her Doctor of Dental Surgery degree from the University of Tennessee in Memphis. She is a general dentist transitioning out of dentistry into other endeavors. This includes developing a fitness clothing line for curvy women, and she is a certified life coach specializing in helping women heal from trauma. She is the proud mother of a bubbly, extremely intelligent 5-year-old future Spelmanite, and she enjoys lots of activities, including dancing, traveling, reading, meeting new people, and networking. Annette Norwood Hill, class of 75, resides in Ellenwood, Georgia, and has a long history of serving in several capacities of the National Alumni Association at the local, regional, and national levels. During the 1990s, president of the Decatur chapter. In 2003, she was elected as the Southeast Regional Coordinator and served from 2004 through 2008. In addition to reestablishing 2 chapters in Stone Mountain, Georgia, and Charleston, South Carolina, she inaugurated the awards committee and served as chair of that committee under the next 2 administrations. At the national level, she worked with former President Deidre Fryer in 2006 to establish the President's Development Institute to appropriately train presidents to successfully fill the responsibilities of their office. She's also served as Affinity Chair, managing a partnership with New York Life Insurance Company and Liberty Mutual Insurance Companies, bringing more than $10,000 of passive income to the association. In 2010, she received the National Association of Spelman College Merit Award. From 2013 to 2015, she served as president of the Decatur chapter, where membership and donations reached a record high. When inviting or encouraging alumni to get involved, her slogan has always been, "It is never too late to start, but it's always too soon to quit." Her dedication and commitment will be valuable to us as she serves the National Alumni Association College as courtesy chair, and it definitely has been valuable. And I will add, of all her many accomplishments, I think one accomplishment that is high at her list is she's a very proud grandmother. Without further ado, I will give the floor to Dr. Eniki Mack.
Hello, everyone. My name is Eniki Mack. I have valvular heart disease. So I actually have a condition called mitral valve prolapse regurgitation. So my journey with this began in medical school. I was sitting in class one day, my heart started racing. So I walked outside the class. So one of the doctors in the class came to help me, and he said, "Oh man, your heart's like racing 200 beats a minute." So they sent me to the ER, and they did a cardiac workup and found through echocardiogram or ultrasound that my valve was abnormal. So the cardiologist said, you have something called mitral valve prolapse. It's not really a big deal. Just take antibiotics before you have any dental work and you'll be fine. So I never worried about it. So finished medical school, finished my training, started working, feeling fine. I established care with my primary care doctor, and I told her about my mitral valve prolapse. And so in 2012, she got an echocardiogram for me, and it showed that my valve was still abnormal, but it wasn't anything to be worried about still. It was mild to moderate in terms of the regurgitation. the top, so with the mitral valve, you have, it's on the left side of the heart. So you have two chambers on the left side, the top and the bottom. The top is called the atrium, the bottom is called the ventricle. The mitral valve sits in between those two chambers. So the mitral valve should close like a trap door. So it'll close and open to keep the blood flowing from the lungs down to the rest of the body. So in my case, my valve, instead of being a trap door with two straight doors, one of my doors was parachuting up like a parachute. So of course, a straight door and a parachute don't close properly. So it let escape the opposite direction. And so that created the problem. So in 2012, when I had a repeat echo, it showed that my valve was a little bit worse, but again, mild to moderate, nothing for me to worry about, just keep living life. And at some point in the future, have it rechecked. So that's what I did. Didn't worry about it, kept living. 2018, I saw my primary care doctor again. And she was listening to my heart, and she said, "Whoa, you have a murmur." I said, I kind of blew it off. I said, "Well, I have mitral valve prolapse, not that big of a deal." And so she kind of let me slide and say, "Okay." But as I kept thinking about it, her reaction, I said, "Well, she kind of reacted pretty strongly, and where she heard the murmur wasn't where you usually hear the murmur." So I listened to it myself, and I said, "Whoa, that is different." So I probably should get another echocardiogram to see what changed. But again, putting yourself on the back burner, I procrastinated, work, life just kept going. So finally, I ended up in the ER because my heart started racing again. And so it's happened over time, and I usually can stop it on my own because I knew what it was and how to treat it. So it's something called supraventricular tachycardia, which means it beats fast, but I can usually on my own get it to stop. So this particular time I couldn't. So I went to the ER, and they gave me some medicine to stop it. And then the cardiologist came in to see me, and he said, "Okay, we'll get you worked up and see what's going on with this murmur, and see if we can prevent your heart from speeding up the way it was." So in my mind, I was going to his office to hear about something called an ablation, where they kind of zap your heart to keep it from going into a fast rhythm, which is a very minor outpatient procedure done in 15 minutes maybe. So I sit in the room, he comes in, he said, "Yeah, so you do have mitral valve prolapse and you need surgery." What? I need what? No, that's not what I came here to hear. So he said, "Yeah, you need surgery. Your valve is very, very abnormal now. The backflow of the blood is severe. It is a jet stream going to the wall of your heart, and it's created an aneurysm. So it weakened the wall of my heart because the blood was going so fast to that part of my heart. My heart had enlarged because it was working so hard to kind of try to get as much blood as it could go in the right direction, but half of it was going the wrong direction. So he said, you're on the verge of being in heart failure. If you do develop heart failure, there's no way we can do anything that will improve your condition." I was like, oh my gosh. So here I am, 38 years old, and you're telling me I need open heart surgery. Like, that's crazy. So after kind of sunk in, he kind of explained, what my options were from a surgical standpoint. So Tracie mentioned the types of valves that are available. Either you get a replacement with a mechanical valve or animal tissue valve. So me being 38, a tissue valve wasn't a good option because they only last 10 to 15 years, and hopefully I live much longer than that. The mechanical valves last a lot longer, but then that leads me to have to be on blood thinners forever. I wasn't excited about that. That's blood sticks every week, once a month, and I had to be on a special diet to keep my blood thin. So I wasn't excited about that at all. Then he said, well, there is an option of a repair. If you can find a good surgeon, so if they can repair your valve, you keep your natural valve, and they just, I guess, clip it in a way that it works better so that your heart can function normally as it should, and you won't need to have any kind of replacement with a mechanical valve, or in the future maybe a tissue valve. So he referred me to a surgeon in Atlanta that specialized in robotic mitral valve surgeries. So when I saw him, he said, "Yes, you're a great candidate for our repair surgery. 90% sure that we can do a repair and not a replacement." So repair means I live life normally, as if I don't have a valve issue. I don't have to do blood thinners. I don't have to do any of that kind of stuff. So I said, yes, let's do it if I have to. So I had my surgery. Everything went well. Complications, with the repair, complications are low, recovery is quick. So after a month, I was back at work. And fast forward 2 years later, this year, when I saw my cardiologist, he said, everything looks great. Your valves functioning well. And heart's back to normal size. So prognosis is good. So that's my story.
Thank you so much, Eniki. I appreciate you sharing your story and answering my call as a classmate. I appreciate that. All right. Next, we'll have Dr. Shermnae Jones.
Good afternoon, everyone. My journey with heart disease started mid-October 2014. I was 10 weeks pregnant, and I had just completed my first 5K. But about a week or so later, I noticed that it was difficult for me to breathe when I would be doing activities, like especially walking, things like that. I would have a feeling of fluid and I would cough, but I just couldn't get rid of that fluid feeling. So I went back and forth to doctors. I had gone to the ER about 3 different times, and I would get my blood pressure checked. They would tell me that my blood pressure's fine. They'd do an EKG, tell me that was normal, and then they would send me home. So the third time I went, it was a Sunday, and it was a Sunday in November. And I went and they sent me home, and I was still coughing. And I said, no, I'm going back, and I'm not leaving until I get an answer, because this is not normal. So when I did that, they ran another test. Instead of an EKG, they ran an echocardiogram, and they found out that I had congestive heart failure. So my ejection fraction, your ejection fraction is a measurement of how effective your left ventricle is with pumping blood through the rest of your body. And normally it's between 50 to 70%. Mine was at 22%. And they start discussing transplants around 15%. So at the time, the doctor that was on call was a Caucasian woman, and she tried her best to convince me to terminate my pregnancy. Her thought was that with pregnancy, you're starting to pump blood for 2 lives instead of just one, so it would increase the workload on my heart, which would weaken my heart and cause further failure. So I refused, because by this time, I'm about 14 weeks. I've been hearing heartbeats. I've been seeing ultrasounds. I've gotten attached to this little life that was growing inside me. So at that point, since she wasn't getting through to me, she decided to send another doctor into the room to try to force me to terminate. And I still refused. I just wasn't going to do it. And then they told me that if I didn't, that I would die. And then that if something went wrong, they would have to make a decision based on 2 patients instead of just one. So I said, well, let me make this easy for you. If something does happen along the line, do what you can to save this baby, and then come back and worry about me. But this baby is going to come here. So once they saw that they just weren't going to be able to talk me into doing that, they ended up transferring me to a specialist. The specialist looked a lot like me. And in not so many words, he was just like, don't do that. I'm going to get you through this. Like, he visited my room that night after hours, the whole 9. So he had me thinking, things were going to be okay. I was going to make it. But he turned out to be divinely sent, because as we went through my care, I learned that his wife was dealing with the exact same thing. It was also their first baby. And so he added just a sense of personal touch to it, because he was going through the exact same thing in his personal life. So I had to make some changes. The most important was to alleviate as much stress as possible, which meant that I couldn't work. I'm a dentist. Dentist's job is very, very stressful. It's physically demanding. So I had to let that go, which added another slight degree of stress, but it took out the physical and mental stress of doing dentistry. I also had to go and see him and the cardiologist regularly. I was on a strict medication regimen, and I had to stop vigorous exercise, which I had started diet and exercise beforehand, working on, getting weight loss. So down on the exercise was a little kick, but I could still do light walking, things like that. And then, of course, the dietary constraints I was already working on. So there was just little tweaks I had to do with that. So during my pregnancy, along with the heart failure, I also developed other issues like gestational diabetes, intermittent blood flow through one of the umbilical arteries. She had intrauterine growth restriction, which all could be tied to and also, my hypertension, which, like Eniki, I developed in dental school. But at the time, it was controlled. So I stayed positive and continued my plan. And so my doctor's original goal was to get me to 28 weeks, which we made it. And then by 28 weeks, my cardiologist did another echocardiogram and discovered that my ejection fraction had gone all the way to 55%. So yeah, I hadn't heard him cuss until that point. But he was amazed. He said that he had never seen a case like mine before, and he probably never would again. He was a little more seasoned. So he'd been in practice for a few decades. So he's convinced he will never see another case like that. He couldn't explain why it developed. He said it wasn't because of the pregnancy, because it was too early. The hypertension was under control. I had no other factors. So the only thing that I really can attribute it to was stress. Because I had work stress, I had relationship stress, dealing with her father, stress from dealing with previous traumatic events, and with the news of possibly losing the baby, I ended up just letting go of all of that. I ended up getting hospitalized at 29 weeks, and I stayed for the remainder of the pregnancy to monitor her more closely. And during this time, my doctor's wife had her baby, so he went on paternity leave, but he would still come and visit me personally whenever he came to the NICU. So I saw him almost every day because he wanted to check in and make sure that we were doing well. And so I made it to 32 weeks, and then it was decided it was time for her to make her grand entrance. So I was in labor for 36 hours, and then they decided, you know what, we're just going to take you to the OR and do a C-section. But she was delivered. She was healthy. She was a small 2 pounds, 15 ounces, but she was a fighter. She was breathing. She was alert. Everything was good. And she only spent 26 days in the NICU. So currently we're both doing well. She'll be 6 next month, and she's very, very bright with a bigger than life personality. I made God and myself a promise that if I made it through all of this, I would work to get as healthy as possible, which I'm doing now. So I'm discovering my true life passions, getting more involved with various forms of dance, and transitioning careers. I often think back on this entire experience and how I was told that I wouldn't survive having her, but I think honestly, she is the one who saved me. So I learned some valuable things here. One, if something doesn't feel right, run with that feeling and persist until you get an answer. Two, fiercely advocate for yourself and your child at all times and any of your loved ones. Number three, stress can and will kill you. So let go of people, places, and situations that do not serve you. And also, nothing is impossible, and you never know what can happen.
All right.
Amen. That is amazing. Yes. Thank you so much. I appreciate it. And there'll be time if you have questions for our speakers, you definitely can put it in the chat box. And if you're on Facebook, you can put it in that chat box as well. And next we'll have our last speaker, Sister Annette Hill.
Well, good afternoon, sisters. And I want to say thank you to all of our panelists, our doctors. I am the unique one. I'm not a doctor. and I'm over 65. So I'm the one with those normal things that would challenge you and give you a more possibilities for having a heart disease. My journey started about 2016. I had pains in my upper left chest area, and it felt like just like gas or something so minor, you wouldn't pay it any attention. And during this time, I was a once a year visit to the doctor, never had any issues, never took any medicines. Um, but she said, well, let's get it checked out. And so she sent me to a well-known cardiologist. He did the stress test and the EKG. And since those both went well, he didn't check any further. So went on through 2017, 2018. I would routinely have those problems, those pains, but it didn't bother me until December of 2018. And those Pam, Cooper, and Bertie, those who know me, they know that there are two things that's dear to my heart. And one is studying God's word. I love to study and teach God's word. And the other thing is line dancing. That is my exercise of choice. When my doctor told me that I was a borderline diabetic, she said, you can control this with diet and exercise. And it's amazing how many things you can control with diet and exercise. And so I started line dancing. I lost over 40 pounds. Um, Here I am in December of 2018. We had several shows to do, and we were at South DeKalb Mall, and I got so tired. I literally had to leave the stage and sit down. And I said to myself, well, I'm losing weight, so that's odd. So I called my doctor the next Monday, that Monday, and she says, well, you want to come before Christmas or after Christmas? Okay, so I'm that busy girl. I got all kind of things to do. I says, well, I'm feeling pretty good. Let's wait until January. So January the 7th, I met with her, and after she examined me, she referred me that very same day to the cardiologist upstairs. She said, I'm sending a patient up to you. He did, and Vanessa and Tracie, I think what they did was a nuclear echogram.
Yes. Yes.
They did a nuclear echogram and a sonogram. And what he said was, your heart should make a donut.
Yeah.
Well, my heart made a C.
Ooh.
And he says, I will see you tomorrow morning at 7:30. And he planned to do a heart catheterization. Well, he said, bring some clothes because you may have to spend the night if I have to put stents in. Long story short, I ended up at St. Joseph's Hospital. I had 3 blockages. I had 98, 89, and 65%. I have this unfortunate gift. I don't know if you can see this, but
Oh, heart pillow.
yeah, it shows where my blockage was.
Mm-hmm.
So I was in the hospital from the 8th of January until the 21st. 6 hours and 5 minutes of surgery.
Mm-hmm.
But I can always say that line dancing is what prompted the need to have the exam. But it was the prayer of not only me, but the prayer of others like Bertie and like Pam, who kept me and brought me through that time. As an intercessor, I'm very familiar with faith. I believe in prayer, but it's always for somebody else. One of the hardest challenges in life is when you have to trust God for yourself.
Amen.
But what I would say is that warning, I got a warning, and I didn't pay enough attention to that. And so I say to my sisters, any pain that persists is an indication that something is wrong. I could have pushed it, but it didn't feel like I had an issue. I have a family history of diabetes. And so when my doctor told me that medicine was my next step, if I didn't lose weight, and change my eating habits. So exercising was good. But when you know your family history, you can do something. They say the best way to predict the future is to plan for it. And so we've got to be more careful about ourselves. One of the statistics I believe is that women wait 30% longer to get help.
Mhm.
And that is so true. And we can all attest to it. And I heard both of the doctors say the same thing, that we just think we're invincible. I mean, our attitude about ourselves is excellent. But we have to surround ourselves with an advocate who is a medical professional, and an advocate who is a sister, a brother, or somebody who will be seriously honest with you and let you know when your decision may not be the best decision for yourself. And so I guess I would say listen to your body, take any warning sign seriously. Do the thing that we know to do, and that is switch off sometimes. Stress, I believe, is a greater contributor to our health than sometimes the things that we do. Like taking care of ourselves, like eating correctly, and like exercising. Know your family history. Say no. So learn to say no and switch off. One of the greatest things that helps me now is having time when I do absolutely nothing, when I can truly rest. I now pay so much attention to everything that happens. Um, I think I go to the doctor too much. But it's better to go and find nothing wrong than not to go and leave something unchecked. And telling your story, I think this is a great panel. I think it's good for us to share our stories because we learn better by instruction. When you have an episode like the three of us have had, you learn by experience, and that's a sure teacher. But we can also learn just as great by instruction, by learning from someone else's story. And then I say your best vote is with your dollars. And so as I began supporting Spelman and the Alumni Association in 1996 and haven't stopped, I began supporting the American Heart Association in 2019 and I haven't stopped. I had my 2-year follow-up a couple of weeks ago, and I had a fantabulous report. I have a great cardiologist. He asked the wrong questions because I gained a little bit of a weight, but he knows now there's a baseline, so he knows when something is not right. And so that's important. Have that baseline so they can check or kind of gauge when something is going wrong. And then check on each other and share your story and support those things that you really value. That's my story.
Yay.
Thank you so much. Now, if we're actually an intimate group, I originally said to type any questions in the chat box, but is there anyone who does have a question? I guess you could raise your hand just so we can make sure that not a lot of people are speaking at once. But does anybody have a question they'd like to ask one of the speakers?
Glad to see my intercessor partner, Laverne, on here. Thank you.
And while
You
people
actually,
may be typing or thinking, I do have a question that I sometimes ask people. I praise God that you guys have done well and you've made it to the other side. But for anybody who may be on the call who's in the going through part, what words of advice do you have? Because there is a low where, you feel like you want to give up, you feel like you're depressed. What were some things that you did to get you from that low and move up to a place of where you are now, a survivor?
I guess for me, it was kind of what Sister Annette kind of spoke to, that it had to be divine intervention to kind of get me to that point. So I, having putzed around and not gotten my repeat echoes to know that the valve had gotten serious, that came into place. Actually, I was so nervous about surgery, even though people have these surgeries all the time, they go, well, but I had a patient that had the same surgery, similar surgery, when he was in his 20s by the same surgeon doing the same robotic procedure. It was like a week before my surgery. I said, okay, this is the Lord speaking to me. I just need to relax, put it in his hands. Clearly, he has this all in play, and everything will be fine. So, just kind of relying on faith and just believing that the Lord's going to take care of this, and they got me through it.
Right. I would say, one, having an advocate for your general practitioner, because she could have easily referred me, but she cared enough about me to say, no, you're going up there now.
Mm-hmm.
And when I went upstairs, and y'all know I couldn't say this in a mixed environment, but when I went upstairs, I told Laverne this when she came to the hospital. I said, I opened the door, and all I saw were old sick people, and I thought, I don't belong here. But she insisted, and I listened. So sometimes the information that we need is before us, but we don't take it. And so I say, allow yourself to be ministered to, allow yourself to be cared for. And if you have a doctor who is not an advocate for you, you need to leave. You must leave. Because as these experts have spoken today, I don't have that level of knowledge. And so when I go, I must rely on the person who's taking care of me. And so I seriously interview doctors who are going to work with me. Even I asked my cardiologist, I said, why are you referring me to this heart surgeon? He says, well, he does a minimum of 2 surgeries, 3 days a week. He's never lost a patient. I said, okay, that's good. That's good. And he's a well-known part of the Emory family. So having an advocate as a health professional, having sisters, brothers, and family around you who will support you, that helps a lot, because it is not easy. It is. I honestly don't remember a lot of that times, and you probably don't either. All I know is when somebody came in my room, whether it was a doctor or I'm like, hello, praise the Lord, what you need? And they told me, you cannot get up. And I said, why? And they said, because you have on yellow socks, and that means that you are not independently ambulatory. I said, oh, give me some more socks. And so my choice was to get better. Just like Shermnae said. Did I say it correctly?
Yes.
Just like Shermnae said, I chose to take the road to life. And that meant whatever I needed to do, let's do it. How can I help you? Help me.
And to add to, I would definitely, and Miss Annette touched on this, to build a support network, family members, friends, just people that you can call on, that, you can talk to, or, people that will uplift you when you're in those moments where you're feeling tired, or you're feeling like you can't do it, or whatever you're feeling. Just having that support really makes a difference.
Agreed. I have a friend, I think on the call, Maisha. She was very interested in helping me kind of get through it and stay positive, and I'll be fine. Everything will be good. So yes, the support system is very, very important and helpful.
We do have an interesting question in the chat, and I think that Tracie might be a good person for this question. It says, when you want to look at family history and discover that one of your parents was adopted, where should you start to find biological family members to get that side of your family history?
I think you have to start by going back, as far as genealogy, you have to go back to the place where you were born and see if they will open the adoption record, and find out whether the adoption record is open or closed. And that will help guide you. And it's kind of difficult because some records are closed. But that's my best advice to you is go back to the place of birth where you were adopted and see if they have any information. It's very difficult.
Another piece of advice I would add, it's an individual choice, but some of the ancestry companies like 23andMe and Ancestry.com might already have DNA from some of your other family members. So if you actually submit your own information, you might get a hit on the relatives that you didn't know and, you know, be able to piece together some of your history that way, because I've known individuals who've been able to do that. Any other questions?
I have it's more of a comment about when they mentioned checking if the family members were adopted. But also, I think we need to spend time talking to our own family members and finding out their medical histories, because we know in the Black community, talking about what someone passed away from might be taboo, but you need to know this kind of information in order to inform yourself. So I would encourage people to make sure they talk to their elders and find out about distant family members, especially if they've died, you know, at a young age. And let's find out what happened so that we can maybe answer the questions when our doctors ask us about our medical history.
I would definitely agree with that. What I failed to mention is while I was pregnant, my father passed away that January from heart failure. His heart was actually at 18%, and he was scheduled to have a surgery February 4th, and he died January 4th. It was very, very stressful. I was very, very distraught because my father and I were very, very close. And but even on his death certificate, along with the heart disease, I did not know that he was also diabetic. So, and I'm not sure if he knew all the way, because typically he would tell me. So I'm not sure if he went regularly to go and, you know, have these things checked too. But it was a shock to me because I didn't even know that he had that. So I would definitely agree with talking to, you know, your elders and finding out what may be in the family, or what they, you know, or even taking them to the doctor for their checkups, because we all know that, you know, our more seasoned family members can be stubborn. So just even going to find out, you know, what their health profile is can give you a lot of information as to what you may, you know, have to encounter.
I do have a question for Tracie in the chat. It says, is Wolff-Parkinson-White syndrome in a young child something to be concerned about, or just a yearly checkup with a cardiologist?
I do think Wolff-Parkinson-White syndrome is something to be concerned about. That is actually an arrhythmia that should be followed more than once a year on a regular basis by a pediatric cardiologist. That's very important to follow up, and more than once a year, at least quarterly, I would do that.
I have a question for Tracie. What happened? I came home on the 21st, and I went right back into the hospital on the 23rd to have thoracic surgery.
Okay.
So is that normal, Tracie, or
what type of thoracic surgery did you have?
let me just, I had a incision in my left side. Because I don't know if my lungs collapsed or if simply there was mucus that they couldn't get out, but something required them to go into my left side, and that was much more painful than the heart surgery.
Did they drain it?
Yes.
A lot of times after people have heart surgery, they will develop what we call pleural effusions, and that's fluid.
Yes, that sounds like
the lung. And it's funny that you say that, because with Black females in particular, we have a lot of readmission rates. That's just something that can occur, which is why with my docs, they tend to leave chest tubes and Blake drains in for a longer period of time, almost to the day you leave, so they can be sure that all fluid is drained from your chest. But that's not uncommon.
I had a chest tube as well, and it stayed in for at least 36 hours.
Yes. it's best to leave it because it's harder when you have to go back in and drain.
Right. Well, they had to go back in, so
That's not comfortable.
that, and that got me. You know, I'm like, okay, Lord. I mean, I've had enough. I can't deal with this because, but you know, here we are, 2 years later.
Doing
So
well.
that, and I guess I said that to say this: no matter what it feels like, you know, we make it through it.
Yes.
And so, whatever we need, I mean, I had so many people who wanted to see me, but that's just not me. I needed to be in isolation. I needed to be with my father so I could heal. I could not talk. I could not taste. Life was just a stress. It was a struggle at that time. And so, if we do have sisters, family members who go through and they say, you know, I'm okay, just kind of leave me alone for a while, they really mean that.
Yeah.
They really mean that. Just let them go in 2 or 3 months when they're able to handle themselves. They're able to present themselves the way that they feel comfortable. It's okay. So my husband wants you there 24/7. I'm just the opposite. I'm just the opposite. So, but people needed to see me because I mean, I went to the doctor on Monday from a meeting. I had to schedule, you talked about motherhood, Tracie. I had to schedule that meeting in the afternoon because I have to take my grandbabies to school in the morning.
I see. You'd be surprised how much you hear about that.
Yeah.
And it's the fact that I don't have any children. That's the first question when I try and challenge anybody on, well, why are you going home? Put your child on the bus. The first question they ask, now, do you have any children? No, I don't. And they'll tell me you do not understand. And my mom agrees, so I understand.
I guess we can take one last question, which is a big one. In the chat is, I'm assuming that those with heart or any known heart issue must check with their doctor before getting a COVID-19 vaccine. So for anybody on the panel that has extra knowledge, if you would like to take it, I guess, Tracie, what are you guys telling your patients? You know, is there a certain period of time after surgery with respect to getting COVID vaccines, or are you telling people to go ahead as soon as it's available to you? What advice are you guys giving?
I think because the COVID-19 is an inflammatory disorder, I think that, and so is surgery. So I think that it would be wise to wait at least 30 days. And that's what we're telling people, to wait at least 30 days before you get the vaccine. But as far as a particular heart condition preventing you from having the vaccine, that has not been a problem. We don't tell people with heart conditions not to have the vaccine. We want everybody to have one. In fact, we follow the CDC recommendations. Unless you have a serious allergic problem or had an allergic reaction, you should get the vaccine.
Really?
Yes.
And that's what I've seen as well. And it comes down to the serious allergic reactions, but almost all conditions, it's better to be vaccinated than to get COVID and deal with the other side of it.
Yeah.
Although it's a personal choice, and we do recognize that. And then this is information, and seriously, I'm stepping a little bit out, but I want people to have enough information to make what we say is an informed choice. Once you have the information and you have the opportunity to think about it, pray about it, and what is right for you, that is your choice. But I don't want any of our sisters or brothers making decisions without full information. And that's just very important to me. And if you've never heard the name of Dr. Kizzy Corbett, I want you to know her name because she is a young woman that is a outstanding African-American scientist and virologist whose research was specifically on making vaccines, viral vaccines with the mRNA technology. She'd been working on this since graduate school and had been perfected it down to a science for years. She used Ebola virus and other viruses as the main that was the main framework with which she was working. But once we were able to take the coronavirus and sequence out that DNA, all they had to do is pop out the RNA for the coronavirus and put it into her technology, which she already spent years on working, and make it. So they were able to build upon her years of her hard labor and others, but she was the lead person to make the vaccine. So that's why it happened so fast. It wasn't like they just kind of did some little voodoo magic in the side and came up with a vaccine, in a couple of weeks. It was because she put in the hard work. Again, your choice, your body, but I want you to understand that this wasn't something that just popped up and somebody that looks like us had a hand in making this come about. Any other thoughts or questions? All right, I will turn the program over to Madam President for closing remarks.
Thank you, Vanessa. Well, this has been a great opportunity for people to hear. We just posted it is on Facebook Live, and you'll be able to begin or direct others to it if they want to hear this information. So I appreciate all of our speakers and panelists for sharing their stories, for sharing their knowledge as they have today. As I said, when we talk about women's health, where else to go but to Spelman College to get this kind of information? And I'm sure you all know that we have these 4 Spelmanites working with us, but there are dozens and hundreds of others who also could have helped us present on this topic. So we're not at a loss for talent. We have it here. I encourage you to reach out to your talented sisters and talk with them about your health issues. I mean, I often see people posting on Facebook they're looking for a physician, and can she be a Spelmanite? So we're out there, and each of us wants to be able to connect with one. So thank you once again for joining us this afternoon. The information has been tremendous. It may be something that we want to do at a later date in the year because it is such important information. Also, what I wanted to mention in the beginning was that our Journalist Sisterhood, which comes out monthly, is now featuring a health and wellness corner. And if you'll read this month's information, Vanessa talks about her experience with getting the COVID vaccine. In the previous month, we talked about intimate partner abuse. So take a moment to read the Journal of Sisterhood. We're trying to provide full information across the spectrum of health issues for our sisters. So please take the opportunity to read that. And other than that, I don't have anything else to say. As Brittany has put in the chat, hats off to the Health and Wellness Committee. They do an excellent job. Thank you, everybody. Good night.
Good night. Thank you.
Thank you, Vanessa. Great job. Thank you, everybody.
Thank you.
Thank you. Good night.
This was a Super Bowl experience.
Yes. Yes.
Vanessa, I'll call you.
Okay.
Enjoyed it, Vanessa. This is Cheryl.
Thank you. Bye.